lucky to have Andrea Amico tonight. She's nationally recognized as a PFAS advocate and co-founder of the Testing for Pease Community Action Group. She tours all over the place and gives talks and raises money for water testing, health studies, policy change, etc. She was honored as USA Today's New Hampshire Woman of the Year.
Woo!
To the exhibit, she's one of our fabulous 40 New Hampshire women trailblazers. Here tonight, PFAS contamination at Pease.
Thank you very much. Making sure, can everybody hear me okay?
Yes.
All right, great. Well, good evening, everyone. Thank you very much for coming out tonight on such a beautiful summer night. I really appreciate you taking the time to be here. And thank you, Tom, for that introduction. My name is Andrea Amico, and I co-founded a community action group, excuse me, called Testing for Pease, and I'm happy to share with you tonight what I have been working on for the last 12 years. So I co-founded a community action group called Testing for Pease, and our mission is to be a reliable resource for education and communication while advocating for a long-term health plan on behalf of those impacted by PFAS water contamination at the former Pease Air Force Base here in Portsmouth, New Hampshire. And I co-founded this group with two other women who are pictured here, Elena Davis and Michelle Dalton. And we formed Testing for Pease because we learned in May of 2014, just hit the 12-year mark, that drinking water wells at the Pease Trade Port were contaminated with chemicals. We then called them PFCs, we now call them PFAS. And at that time, all of our children were attending daycare at the Pease Trade Port. My husband was working for a company there, and Elena and Michelle had also worked at Pease. So this was a very personal issue for us. Our families were directly impacted, our children. And so we didn't know anything about the contamination. We didn't know anything about the chemicals, but we quickly organized together to form our group and start pushing for action and answers. So before I get into more of our story, I just want to give you some background information on PFAS, but I'd love to know in the room who here has heard of PFAS or PFCs. Okay, good. All right, great. Becoming more mainstream, good and bad, you know, more awareness for sure, but they're not a great thing. So PFAS have been prevalent in our local community as well as our state, across the nation and across the world. PFAS stands for per and polyfluoral alkyl substances, and they're a class of over 12,000 man-made chemicals that have very useful properties. So they're water repellent, they're heat resistant, they're grease resistant, they're great at putting out certain kinds of fires. However, they bioaccumulate and they're very persistent in the environment, in wildlife, and in humans. And so for anyone who loves chemistry, if you look at this figure here on the slide, you will notice that PFAS are bonded by carbon in a fluorine bond, which is one of the strongest bonds there is. And it makes it nearly impossible to break. And that's why it's so persistent and why they don't break down and naturally attenuate like other chemicals. And this is why PFAS are commonly referred to as forever chemicals. So sometimes you hear them called that in the media or in other discussions. And it's a reason why they're so concerning, is because they don't break down. And where can you find these chemicals? Frankly, they're everywhere. Because of all their useful properties, they're found in nonstick cookware, food packaging, waterproof clothing, couches, carpets, firefighting foam, dental floss, cosmetics, and more. And so because of this, 99% of Americans have some detectable levels of PFAS in their blood. So frankly, everyone in this room probably has some amount of PFAS in your blood just due to your exposure through everyday products. And why are we concerned about PFAS? I often say, you know, if something seems too good to be true, it often is, meaning like all those great properties of heat resistant and grease resistant and stain resistant. Well, you know, we benefit from that as consumers, but there's a downside to it. And as I said, PFAS are often referred to as forever chemicals because of their persistence in the body. And they have been associated with multiple adverse health effects. And I really like this slide here because it shows that it impacts multiple tissues and multiple systems of the human body. So such as the immune system effects, thyroid and liver issues, different types of cancer. It affects babies. It can pass the placenta when a woman's pregnant. It can pass through breast milk. So it's not just generations here today, it's even future generations are continuing to be affected by this. So getting back to Pease and just a little bit more about the local story here. For some of you that may not be familiar, Pease was an active Air Force base from 1956 to 1991. It's made up of about 4,300 acres of land. And in 1990, the military began leaving and the Air Force Base officially closed in 1991. And when the base closed, Pease was classified as a Superfund site. A Superfund site is a heavily contaminated area identified by the EPA because it poses risk to the human health and or the environment. And at that time in 1991, when it was classified as Superfund site, it wasn't because of the PFAS contamination. They hadn't even started testing for PFAS back then. It was due to a lot of other historical contamination that the base had used when it was open with things like jet fuels and TCE and solvents and things like that. So Pease has a legacy of historical contamination beyond just the PFAS. So I just think that's important to note. In 1991, the Pease trade port started developing and the old Air Force Base was transformed and repurposed into the active industrial park we all know today. If you're familiar with the area, it's home to a couple hundred different businesses. There's still an active airport. There's an active Air National Guard at Pease, a golf course, daycare centers, restaurants. It's a very large economic hub for the seacoast and for the entire state of New Hampshire. And I will say in my conversation with the Air Force too, they're very proud of Pease, you know, that the Air Force where they were able to take this old base and repurpose it into something really meaningful to the community. And so some people say, well, where did the PFAS come from at Pease? So the source of PFAS at Pease is something called AFFF, aqueous film forming foam. It's firefighting foam. That was designed specifically to put out petroleum-based fires. And so they used this foam as far back as the 1970s, and they used it a lot for fire training activities. They would light things on fire and then use the foam to put it out. And there also was a very large plane fire on the runway back in 1990. You can actually look it up on YouTube, and there's a video of them dousing the plane with hundreds of thousands of gallons of this AFFF. And so that's where the source of PFAS came, was through the use of this firefighting foam, through training exercises and putting out petroleum-based fires. And, you know, one thing that has always really struck me is that, you know, this foam that they started using as far back as the 1970s is still contaminating our local area. You know, these PFAS, as I said, they don't break down. They're forever chemicals. And so even decades ago, something they used is still affecting our community today. And sadly, Pease is not unique or alone. We were one of the first communities in the nation to discover this serious problem. However, the Air Force and other branches of the military use this same firefighting foam at all of their military sites across the country. So the US military currently estimates about 700 sites across the nation, just like Pease, where they have PFAS contamination. And it's not just the military that's an issue. In a town about an hour from here in southern New Hampshire, Merrimack, New Hampshire, you may have heard that they are also dealing with PFAS contamination, but from a different source. There was a Saint-Gobain performance plastics factory that was there, and the factory used PFAS to coat textiles, and then through that manufacturing process emitted PFAS out into the air, and then it settled down and it has contaminated thousands of private wells in the area. And then if you've lived in the area for a while, you've probably heard of Coakley Landfill, which is in Greenland, Northampton, and Rye. It's also a Superfund site, just like Pease, and there have been high levels of PFAS detected leaching from the landfill into surrounding private wells in the environment. So it's not just military bases, it's multiple sources like industrial and landfill, airports, fire stations. are common places where you can find this contamination. And I really like this map from the Environmental Working Group. This is actually, it's not interactive on my screen, but if you go to the Environmental Working Group website, you can click on this map and you can zoom in and out. You can click on the dots and it will tell you, you know, what PFAS were found at what levels, what's the source. So if you really want to kind of hone in on certain areas, it's great. And then New Hampshire also has a very similar map, so I wanted to share it with you. So New Hampshire Department of Environmental Services has a PFAS sampling dashboard. And this is also an interactive map. And I'm showing, you know, this is the state of New Hampshire and what we look like with all the dots on our map. There's lots of dots. I'll say New Hampshire has been really aggressive in going out and sampling for PFAS all across the state, looking in places like airports, landfills, fire training areas, things like that. So I do talk a lot about PFAS in drinking water because that's how I first came to learn about it. That's how my family's been impacted, but PFAS in water is truly the tip of the iceberg. I see headlines every day about PFAS in our food, on our farms, in our rainwater, in sea spray, in firefighters' gear, and more. I just recently saw an article that they're in Band-Aids. So the use of PFAS in our everyday products has become so pervasive, it really is hard to avoid exposure. But I'm going to talk about that a little bit later about things that you can do. Okay, so now that you've had an overview of my group testing for Pease and what PFAS are and why we are concerned, I want to get into some of the advocacy and accomplishments that we've had. So back in 2015, our initial goal was really just blood testing. We knew the community had been exposed. We knew they drank highly contaminated water, and we just wanted PFAS blood testing to know like how much of these chemicals are in our blood. And that took a lot of advocacy. We initially started with the state health department, and they weren't super responsive initially, so we had to use the power of the media and our elected officials to really put pressure on them to offer that. But they did eventually offer a PFAS blood testing program to the community. During this time too, we saw multiple groups starting to form. The city formed a CAB, a community advisory board, and we saw the Air Force put a restoration advisory board together. And so we started seeing a lot of different boards forming, and we advocated to have a seat at those tables so we could really share the community concerns. And you have to remember too, back then it was really tough because PFAS were unregulated. They were contaminants of concern, but they didn't have any standards or guidelines. And so we were really pushing for, you know, blood testing and health studies and cleanup. And it was like these contaminants that at the time, everyone's like, well, we don't know enough about them. We don't know what to do. And so we kind of took that and said, well, if you don't know, you have to do something. You know, this whole community's been exposed. You have to do something. And during this time, we also were successful in getting the Air Force to agree to treat all the drinking wells at Pease, which, you know, of course, in my mind, like they should do that. They were the responsible party. But again, having unregulated contaminants, it can be really hard to get the federal government to spend money on something when there's not a regulation or a law telling them to do that. So that was not an easy feat, but very glad that we got that done. In 2017, and based on high levels of PFAS that were detected in the community's blood as a result of that program, the CDC recommended a human health study at Pease. Initially, the Air Force refused to pay for that study. They said they didn't have the legal authority to fund health studies, but thankfully Senator Shaheen stepped in and wrote legislation that mandated the Department of Defense pay for the study. And during this time, I was also asked to provide testimony at the first ever Senate hearing on PFAS in 2018. And then also at this time, I was invited to meet with then EPA Administrator Scott Pruitt to share the community experience and needs of the community with the EPA Administrator. In 2019, I was invited to attend the President's State of the Union address with Senator Shaheen to raise awareness of PFAS issues in New Hampshire and across the nation at such a high-profile federal event. And New Hampshire was one of the first states during this time to set drinking water standards in the nation, which also, prior to doing any of this work, none of this would mean anything to me, but typically in New Hampshire, we're a small state. We rely on the EPA to set standards for drinking water. They have more resources, more scientists. And we really just defer to the federal regulation. But in the absence of federal regulations at this time, and communities like Pease and Merrimack and other places finding this PFAS, New Hampshire had to get out in front of this and set their own drinking water standards. And again, not an easy feat. They hired a toxicologist, they held public meetings, and we really rallied the community around supporting the need for these PFAS regulations. So I'm really proud of New Hampshire, the little state of New Hampshire, who usually doesn't do something like that, really stepped up to the plate and did a great job with that. I'll just say too, at that time, I was also invited to give a TEDx talk at the Portsmouth Music Hall on my journey as a PFAS advocate. So I have the link on my slides here if anyone ever wants to watch that. In 2021, we continue to see progress on the remediation side with the Air Force paying for drinking water and groundwater filtration at Pease. On the legislation side, Senator Shaheen led the way to make sure $10 billion was allocated in the infrastructure bill to pay for PFAS across the nation. So, you know, that's a 10 billion, like that's a lot of money, and it's much needed because again, you saw all the dots on the map. It's not just a few communities, really the whole nation is grappling with this issue. So it was really great to see such a large pot of money put aside for that. In 2021, I was also invited by Senator Hassan to testify again at a Senate hearing on PFAS in DC. And it was also during this time I advocated to the Portsmouth City Council to establish a safe water advisory group. We call ourselves the SWAG. And we still meet today. We've been up and running since 2021, and we meet quarterly. And really the focus of that group was to, you know, from the community side, we saw a lot of PFAS regulations and changes happening, and we didn't have a way as residents or community members to like inform the city council and talk to the school board about that or talk to the water department. And so we saw a need to form a group with multiple stakeholders that meets quarterly to talk about these changes and just keep track of them and see how they're going to affect the city. And since then, we've seen a lot of changes and things that have affected the city. And so I'm really grateful for that group and that we have this way to all come together. And so I talk about it a little bit later, but if you're local and in Portsmouth and ever want to attend, we'd love to have you. So more recently, I was asked to be a community liaison on a National Academy of Science panel that convened on PFAS and clinical outcomes. And I was able to present on the community needs and challenges related to PFAS and medical monitoring. And I'll just say as a side note to that, when my family was exposed to PFAS, it was really challenging, like going to the pediatrician and being like, what do I do? You know, my children drink this contaminated water as babies and toddlers, and what do we do to monitor their health? And my doctor at first was like, I don't even know what PFAS are. Like, I have no idea, you know? And so a lot of people in the community were facing challenges with our healthcare community, just not knowing. They don't, you know, physicians don't get a lot of training on environmental health. And so we really saw a need for better physician outreach and education so they could meet the needs of the people who had been exposed and make sure they could come up with a plan to help monitor their health after the exposure. So I was really honored to be asked to be part of that panel to share the challenges the communities face and really advocate for more of that physician guidance and medical monitoring. Also under this time, we saw that the Biden EPA made some giant steps forward on PFAS. So again, I mentioned how New Hampshire passed drinking water standards in 2019. We saw in 2022 and 2023 progress at the federal level, where the EPA proposed their first ever federal drinking water standards. So that was great. And we also saw that EPA was proposing to designate two common PFAS, PFOA and PFOS, as hazardous substances. And that's kind of a complex legal term under, you know, Superfund law, but essentially what it would mean is that it would have this process to hold polluters accountable. It would help communities. It would provide resources for cleanup and things like that. So again, big step in the right direction for all these communities who had been impacted by this exposure. So finally, in 2024, we did see that the Biden administration did finalize federal drinking water standards, which was a huge accomplishment. We were thrilled to see that. It was big progress. It meant, you know, prior to that, you had New Hampshire who had regulations, other states, Massachusetts set regulations. They were different than New Hampshire. it kind of mattered like what state you lived in versus how clean your water was, for PFAS. And that felt wrong. Like you shouldn't have stricter standards here in New Hampshire than they have in, let's say, North Carolina. Like everybody should have access to clean water. Everyone should have standards that protect their health. And so definitely having those federal standards are huge. And at the time, EPA estimated about 100 million people would be provided cleaner drinking water because of these standards and the requirements to have to filter the water. They also said it would result in a reduction in tens of thousands of PFAS attributable illnesses or deaths. And due to these drinking water standards, we actually will see cleaner water here in our own city because 3 of the city wells will now require treatment, which means safer drinking water for those of us even here on city water. So, but, I'm going to talk about this a little bit later. We have sadly seen some rollbacks, and the Biden administration, they regulated 6 PFAS. And if you recall, we have over 12,000. So, just regulating a handful is a good start, but we certainly, as an impacted community member and someone who's been working on this issue for over a decade, we're not going to regulate this one PFAS at a time. Really, we need to regulate as a class. And we just really need to stop using these chemicals. Right now, they are still in production. They're still in our products. We've seen some states put through PFAS bans. The best one I've seen is Minnesota, where they really define what is essential use and non-essential use, and they're working to phase out non-essential uses of PFAS. So again, really big progress, and this was great, but it's like just a small step in a bigger thing of, efforts that need to be made. So, also last year I was able to partner with UNH. So we noticed foam accumulating in Great Bay. And so we noticed in other states, they had also had foam accumulating in their waterways where there was high levels of PFAS contamination. And we advocated to do some foam testing around Great Bay. And I was really honored to partner with Dr. Paula Mauser from UNH. And she was able to obtain funding from the New Hampshire Sea Grant. So we could go out and collect some foam samples that were accumulating. And as a result, and the levels did come back where PFAS did concentrate in the foam. So as a result of that, the state of New Hampshire issued a fact sheet basically informing people to avoid surface water foams, like don't let your dogs play in it, don't let your kids play in it. If you do come into contact with it, you should wash your hands. But, beyond just drinking water, we really care about the impacts to Great Bay and the surrounding community, the wildlife. And it was really great to be able to have a smaller project to work on with an academic partner. And then for this year, I was really honored by this organization to be recognized as a New Hampshire Woman Trailblazer. And I got to bring my daughters to the opening night, and that was really special. And I'm deeply honored and grateful for that recognition. And then actually this Sunday I leave. I've been invited to speak at the National PFAS Conference in Arizona. It's in Tucson this year. And so I've been asked to speak on a panel about a mom, speak from the position of a mother who's had children affected and children's health effects and things like that. So really great that I can bring my story to a national stage to share my experience. But as I mentioned, so unfortunately, just a few weeks ago, we did learn under the Trump EPA Administrator Lee Zeldin that they are actually going to roll back some of the PFAS regulations that were passed 2 years ago. So as I mentioned, there were 6 PFAS that Biden EPA was going to regulate, and now the Trump EPA is only going to regulate 2 of them. And the Biden EPA was also giving water systems 5 years to implement treatment, 2029, and the Trump EPA is allowing a 2-year extension to 2031. So essentially they're weakening the standards and they're delaying the implementation. And so that means that people are going to drink chemicals, the PFAS chemicals in their water that, just a couple of years ago, the EPA are saying isn't safe. And so I just, for me, PFAS isn't really, it shouldn't be a political issue. Overall, we've actually seen a lot of bipartisan support on PFAS issues because at the end of the day, we all need clean, safe drinking water. It shouldn't matter what political party you're part of. But this is, really unfortunate. This is definitely a big setback, especially after seeing so much momentum in the last, few years between that infrastructure bill and the drinking water standards. There's money there to help these communities. So, but it's okay. One foot in front of the other every day, and we just keep showing up, keep advocating. And so, but I just wanted to make you aware of that. And so, I've talked about this a lot, but we have worked with several different agencies throughout our time together. At the local level, we've worked with the city council, the Department of Public Works, the city health officer, our mayor. At the state level, we've worked a lot with New Hampshire Department of Environmental Services, New Hampshire Department of Health and Human Services. And then at the federal level, we've worked with the CDC and a sister branch called Agency for Toxic Substances and Disease Registry, which was a mouthful. ATSDR, they're essentially the sister branch of the CDC that investigates environmental contamination. So they did one of the health studies here. And of course, we worked with the US Air Force, the Department of Defense, and the EPA. And, I mentioned it in part of my talk, but really we could not have been effective without the support and help of our federal and state and local officials. And so we've been really fortunate here in New Hampshire to have a lot of really great representatives who have really helped us out and have been really responsive and have done amazing work, not only to help our community, but has had a ripple effect across the nation. And I think New Hampshire has really been seen as a leader at times on PFAS. I know even just folks that I know from other states will say, well, my congressman, my senator is going to call Senator Shaheen's staff because they're, they know everything about PFAS. So it's really great that we've had amazing representation at the local, state, and federal level. And another group I just wanted to highlight for you, we helped form is the National PFAS Contamination Coalition. So we helped to co-found this group in 2017. It was actually at the first National PFAS Conference in Boston. And right now we have over 30 community groups from 17 different states, all working together to tackle PFAS at the federal level. So we collaborate and share information with other communities across the nation. And it's been so instrumental in just helping leverage the government and our elected officials to push for action and change. So many of us have flown to DC and done lobby days. And, there's times where there's different legislation we're trying to get passed and we really need to target, North Carolina or Minnesota. And we have people in our coalition and we're like, okay, you got to call your people. And, so we're all like always leveraging each other and supporting each other, and sharing information is huge. So it's been really great to be part of this bigger network of people, because it's not just Pease, it's not just New Hampshire. Frankly, it's, it's a global issue, but here in the States, it's great to have this coalition. So challenges we faced, we certainly have faced a lot. In 12 years, I've learned a lot. I don't do this work full time. I work as an occupational therapist. So I work in healthcare and I have 3 children now. And so this is really just like something I have educated myself on and dedicate in my free time working on. And so we've faced a lot of challenges. I've learned a lot along the way. I didn't have any specialized training or anything like that. But, what we started with initially was we had unregulated contaminants when the contamination was first discovered. So really just trying to even get action on something that didn't have standards was really hard. Initially, we had to really push to say, like, the community needs to have a seat at the table. We need to be on these boards. We need to have representation, because sometimes communities, I think sometimes the position is like our government will just fix it and we don't need you. And we were like, no, we're closest to the problem. Like, we know what we need. Please let us be on these boards and be part of the decision making. And at first we had to really push for that. Now, not so much anymore. Something else we've seen, our government moves really slow. We have seen tremendous progress on PFAS in 10 years, but like I mentioned, the health study that we've done with the CDC, that wrapped up in 2021, and we still don't have our results. They're still analyzing the data. So things just move really slow. I touched upon this earlier. Physicians need education on PFAS to help patients and be proactive in protecting health. We've made some progress on that. There are some working groups nationally that are trying to create CME courses, continuing medical education for physicians, but that's certainly a gap that we still need to keep closing, because people are exposed to PFAS and we need healthcare providers that are educated on what the health effects are and like, what can you do? What can you tell your patients to do? PFAS is a large class of ubiquitous chemicals. They're in our everyday lives. It's also really hard to test. You can't test for all of them. A standard water test tests for about 40. And also people want to test other things like, we know people that want to test like their chicken eggs for PFAS, or they want to test cow's milk, or, there's some women who have had high exposures who are like, I'd love to be able to test my breast milk before I breastfeed my baby. There's other things, there's other ways that it would be beneficial to test for these chemicals, but it's just not easily accessible. It's getting better, but evolving science on health effects. So back in 2014, at first they're like, the state health department was like, we don't even think these cause health effects, and now we know that that's not true, and we know that the science continues to evolve. So that's another thing that can be tricky though, when you're trying to advocate around something and the science is constantly evolving. It's hard. And sometimes what I have found is that in the lack of certainty at times, the government doesn't want to act. If they're like, well, we don't know for sure, so we know that some studies have shown it, so we're just not going to do anything yet. And it's like, why do the chemicals get the benefit of the doubt? If you know something causes harm, you should, give public health the benefit of the doubt. I touched upon the limited lab capabilities. That's certainly a challenge at times. And then again, as I mentioned, all the government agencies we work with, it can be difficult to streamline communication between multiple agencies. So, that's tough. And then the last slide, or the last point I'll say, there's no safe way to fully destroy PFAS. There's tremendous progress being made on this. So much money is being allocated into technologies to be able to destroy PFAS, which is great. Again, I still think we just need to stop using them. We need to stop putting them into production, but there is a lot of progress being made on that. So that's great. And I will say how that kind of applies to Pease. So right now at Pease, they have filtration plants up and running, and they filter the PFAS out of the water, but then they take the PFAS that they filter and they just send it to a landfill in Michigan, like a Class E hazardous waste landfill. So the challenge with PFAS is like, right now, we're not getting rid of it, we're just kind of moving it around, and on one hand, it feels great. Like, thank you so much, Air Force, for getting this PFAS out of our community and out of our environment. But then it doesn't feel great that they're just like packaging it up and sending it to somebody else's community, So that's certainly been a challenge. And then another remediation technology or destruction technology is incineration, where they can heat up the PFAS really, it takes really high temperatures to destroy it. But they're finding that even then the PFAS just become airborne and become a gas. And then it contaminates the communities that host the incinerators. And sadly, those tend to be environmental justice communities, or communities that don't have the resources to educate and advocate to not have these chemicals brought to their town and incinerated and just put back in the environment. So again, just all the more reason why these chemicals, really, we shouldn't be using them in non-essential ways. But we've had a lot of positive developments along the way too. So we did have a PFAS blood testing program that was offered, and over 1,800 people participated in that. We've worked with, I said, the CDC on a federal health study, and we also had a smaller children's health study that was offered to our community. We developed relationships with multiple government agencies and elected officials. I have, really gotten to know the staff members of, Senator Shaheen and Senator Hassan and Congressman Pappas, and they're all lovely people who, are really trying hard to help work with communities to solve this issue, and I'm grateful for those relationships. We've also seen treatment of the drinking water at Pease as well as the groundwater. And the last figure the Air Force shared with us is they've spent over $95 million at Pease on PFAS alone since 2014. Like that's a lot of money for one site. And if you recall, I said they have about 700 sites across the nation that they're having to deal with. So it's a big issue for the Department of Defense, and it's going to cost them a lot of money. We've also had opportunities for grants to support our community efforts, like I mentioned, working with UNH and the New Hampshire Sea Grant. We've also had some other local organizations support us doing some additional testing. We helped form a national coalition of advocates, so it wasn't just us here at Pease. We're able to share our knowledge and what we've done here with others across the country, as well as them sharing with us. Our study at Pease with the CDC actually became a pilot study, and the CDC ended up studying 7 other sites across the country. So they call it the multi-site PFAS study. So that was really great to know that what the work we did here, we ended up being a pilot and a model for 7 other sites. And I mentioned how we don't have those results back yet. And part of that is because they studied these 7 other sites, and now they have 8 communities where they're trying to compile the data and kind of give us a, a bigger picture and not just study one community, but study multiple communities who have been exposed so they can try to learn and have better statistical power. So it's great to be a pilot and a leader at the federal level. Have been to DC multiple times to be able to advocate. That's always an amazing experience. Have been able to work with highly respected doctors, epidemiologists, scientists, environmental health experts, meeting people I would never meet in my normal everyday life. So it's been really awesome. And then of course, having the regulations finally at the state and the federal level. So what I'm hoping you will take away from today is that, PFAS are everywhere. Really, it's hard to avoid them and we're all exposed. It's a local, state, federal, and global issue, so it's not unique to New Hampshire or Portsmouth or Pease. It's, it's a massive problem. The media has been really effective in helping us raise awareness and accountability. There's been times where our government hasn't done the right thing or they're not doing the right thing, and being able to kind of call that out in the media can help put pressure on them. That was very effective for us early on in our journey when, again, no other community was dealing with this. Our government wasn't sure how to react. We were able to use the media effectively to really put pressure on them. And then also just that strong grassroots activism, like just 3 moms at Pease, coming together and in combination with elected officials. And it really was a winning combination for us. We didn't know what we were doing. We just knew that our family had been affected. We wanted answers and action for our community, and we came together. And I just want to empower all of you that you can do that too. It doesn't have to be PFAS. It can be, climate change or microplastics or, the eelgrass in Great Bay, like whatever's important to you. You can find your cause and put some energy and effort into it. And it can make a big difference. And then lastly, I've had to learn this the hard way at times, but this work has been a marathon and not a sprint. I've been at it for 12 years. And so there's times where I have to be like, okay, it's okay to like slow down, or you don't have to return that email tonight, or, it's okay. And so oftentimes with big issues like PFAS, it's not something you're going to solve overnight. So just do what you can when you can and pace yourself. So I know that, I talked a lot about PFAS and the dangers, and they're everywhere, and it can be a little daunting, like, oh geez, what am I supposed to do? So I wanted to leave you with some resources for reducing PFAS exposure. And so these are 3 great resources that I really like. And, they talk about things that you can do, like filtering your drinking water. So if you have PFAS in your water, you can filter it. If you live on a private well, you should have your water tested for PFAS. And the state of New Hampshire has a lot of programs where they do that, or they can point you in the right direction. You can avoid food products and packaging that may be high in PFAS. So like things like microwave popcorn bags, fast food wrappers, things like that. Again, it's impossible to know, but like there are certain places we know they're there. So just making conscious decisions. You can avoid nonstick cookware. So try to use mostly stainless steel or glass. And you can try to avoid waterproof clothing. Again, not perfect. We live in New England. We see a lot of snow and extreme weather. So, but just knowing that's in those things, those are small steps you can take to try to reduce your exposure. And I really like these different organizations. The PFAS Exchange is with Silent Spring Institute. They're an organization outside of Waltham, and they have a lot of great resources. There's also the Environmental Working Group. We talked about them earlier in different ways. EWG has great resources, not just on PFAS. They have it on, cosmetics, and they sample produce for pesticides, but they also do a lot on PFAS, and they have a whole website dedicated to that. And the EPA actually, and I checked, this hasn't changed. The EPA website still has a lot of things that you can do to limit your exposure. So if you're feeling overwhelmed or stressed after tonight, I just recommend reading some of those things, because there are things you can do. And so, and then the other thing I just like to point out too is that there are some companies doing the right thing. So we don't have a federal PFAS ban or anything like that yet, but we are definitely seeing big companies recognizing, like, wow, these, there's been lawsuits against like DuPont and 3M, the companies that made these chemicals. And so I'm seeing more and more companies trying to do the right thing. Keen Footwear is a great one. They have completely phased out PFAS. We're seeing, some like carpet manufacturers, other big name clothing brands, some fast food wrappers, and that's all great. What I will just caution you is the devil is in the details. So as I mentioned, there's over 12,000 PFAS. So when a company says we're phasing out PFAS, it's like, well, what does that mean? Like, are you phasing out like PFOA or PFOS, which is the two common, most prevalently known PFAS, which shouldn't even be in production anymore, but or are you just replacing those with like a replacement PFAS, And I didn't get into this, but there's the long chain PFAS, meaning the long carbon chain. Those are your older PFAS. They call them the legacy ones that we know are really toxic. And then there's these replacement ones where they've started making them in the last, 20, 30 years, and they're shorter chain, so they're less persistent and, they don't build up as much, but their research is also showing that even the replacement PFAS, it's kind of like the BPA, you just change one molecule and it's like, it's different, but is it better? So I think that's something I know I applaud companies who are trying to do the right thing, but I always think you ask the question of like, well, what does PFAS free truly mean? Is it all PFAS, or are you just like taking older PFAS and replacing them with new ones? And then, I just want to leave you with some more information too, if you want to learn more or get involved. As I mentioned, the City of Portsmouth has a Safe Water Advisory Group. It meets at City Hall quarterly. We have a website, and I co-chair that group. And so, would love to see people come out to that. And you can join over Zoom too if you don't want to come in person. There's a Restoration Advisory Board, which is through the Air Force, and that meets, we used to meet quarterly, we don't meet as much anymore, but a few times a year, usually at Pease, sometimes Newington Town Hall, and that group really focuses on what the Air Force is doing at Pease to address PFAS, so we don't really talk about health effects or anything like that. The focus is truly what the Air Force is doing regarding cleanup. Those meetings can get a little technical, there's lots of engineers, but it's very interesting, and the Air Force has done a lot in terms of filtration and investigation and sampling there. There's also a Seacoast Drinking Water Commission, which is a state commission. They meet a few times a year. There's the Great Bay Changemakers program. So this has been a really great program I've been through. So it's not PFAS specific, but there's a group, they run a boot camp every fall. They meet like 4 or 5 times for a couple hours, but they really bring people together who want to work on the environment, So I went through that program, and of course I was there from like a PFAS lens, but there were people in their community who wanted to deal with a dam, being removed in their community. There were some people that cared about climate change. There were people that care about, eelgrass in Great Bay. And so anyways, if you're interested in learning more, it's really like a training on how to be an advocate. And I really, even though I had been an advocate for a long time, I still learned a lot in that group. And I met some really nice people who also care about about issues, and I learned a lot as well. We've had several presentations about PFAS research in Great Bay with speakers from UNH, Dartmouth, and the Department of Environmental Services. So we've had 3 so far, and they're doing a lot of work there. This photo in the middle is just a flyer, but all of those presentations have been recorded. So if you're interested, they've tested like shellfish and all kinds of, wildlife, and, it's just been really helpful and interesting to learn about that. And then lastly, I just wanted to mention, there's actually a talk coming up in a couple weeks on June 16th. It's going to be it's in Greenland at the Great Bay Reserve, and this one is specific to PFAS, but it is on water and biosolids, because you may have heard, I didn't really talk about it today, but there's been a lot of issues with biosolids being spread on farms and then causing high levels of PFAS to contaminate the farms and contaminate the food and the wildlife. And so Maine has had a very big issue with PFAS and farms and biosolids. And, here's a talk, and there actually is a farmer from Maine who's going to talk about it. So if you have any interest in PFAS and biosolids, I just wanted to let you know that was coming up. And so with that, I've been talking for a really long time. Thank you so much. And I'm just going to leave you all with this quote that says, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." And I just want to thank you so much for listening to me tonight. And I really look forward to answering any questions that you have. And if you ever want to reach out to me, we have a website, and we have a Facebook page, and we're also on Twitter too, but mostly Facebook. So yeah, thank you so much. Thank you.
I was stationed on Peace, me and my family, and actually lived on the basement. In the last year, I went into the engineering group, I could get out. And George Baker was the chief of engineering. And we had a filtration plant that they built because of this contamination, but they never turned it on. And this other filtration plant was a lot different than the one that we spent like $2.2 million for and never did anything.
Yeah.
Then once they all take the other two, how safe is bottled water, and the other thing is the firefighting suits.
Mhm.
They run a couple of $1,000, and of course they probably use PFAS
They do,
for other
yes.
chemicals. My question is, why go through the destruction process when it's still
Exactly, yeah.
we shouldn't even do that.
Yeah.
But the firefighters, how did we safely destroy the firefighter suits? But they have to, they're very expensive.
Yeah.
A fire team, you're talking $500,000 for a suit.
Right, right, and you're absolutely right, they're completely impregnated with the PFAS because they're heat resistant, water resistant. And we've seen a big movement of firefighters nationally coming out against PFAS because they're like, well, not only are we, well, it's in their blood, they handle the foam that is high, you know, has PFAS in it. You know, I know the firefighters, it was City of Portsmouth Firefighter Station at Pease, were like, we, you know, we'll wear the gear, we use the foam, we're drinking the water, we're bathing in the water, you know, cooking with the water, you know, so we've definitely seen firefighters rally around PFAS regulations and wanting PFAS-free gear. And there's manufacturers now making PFAS-free turnout gear for firefighters.
They're exposed to a lot of forever.
Yeah. Well, right there, and they have higher rates of occupational cancer, and you know, so they've been a group that has certainly rallied behind wanting change when it comes to their gear and regulations, which is great because firefighters, their unions can be very effective in pushing legislators and policymakers. So there, and then I'll go to you.
Any research being done on the medical side to try to reduce PFAS levels in the body, say with a dialysis process or a chelation process?
Yeah, that's a great question. That's something I know even when my family was, but when we first found out and my kids had really high levels in their blood, my husband was like, listen, I'm so glad you're out here advocating, Andrea, but like, I just want this stuff out of their body faster. You know, like, I don't want to wait and study their health to find out they're going to get sick. There are active studies going on right now. So one of the things that's been effective is an old cholesterol medication called cholestyramine, and that people don't use very much anymore, but they found, for whatever reason, it binds to the PFAS and it gets it out pretty fast. So there's been studies in Europe, and I'm happy to say there's actually some studies going on here. There's some going on in Maine, some of the farmers. So nothing that has been approved yet, or nothing that people would say, yes, go ahead and do. But that's one thing they're looking at. Something else that's been discussed, again, not approved, is something called therapeutic phlebotomy. So interestingly enough, I remember one of the firefighters who worked at Pease talking to me after a meeting one time, and he was like, I don't understand it. Like, all my colleagues have really high levels of PFAS and I don't. And then he's like, I was talking and I'm like a Red Cross super donor. And he's like, I donate blood like every 6 weeks or whatever you can. And so he's like, I was ridding it of my blood through that. And so there have been some studies on that, donating blood, which I feel like that's a little controversial though. If you have hypertension, you're donating blood, but that's another thing that they're looking at. And there's,
you take it.
yeah, I know, but I'm just, you know, it's just like kind of an anecdotal thing, but there have been some studies on that. And then there also have been some studies looking at like high fiber diet, oats, things like that can help. So yes, there is research going on, but to the best of my knowledge, there's like nothing concrete. Like, I couldn't go to, I mean, I guess I could maybe ask my doctor to prescribe me cholestyramine, but it's not like mainstream yet. But there's efforts being made to study that. And I think that's something that early on, I can tell you, there wasn't a lot of advocacy around it. It was more just like, we want blood testing, study our health, clean up our water. And there's definitely been more of a push of like, can we just, how do we get this out of our body faster? So, great question.
I don't remember the name of the movie, I wish they did, but years ago I watched the movie which got me interested in that, if you will. Interested in word, but, it was about down south of DuPont and this lawyer.
Dark waters, I
Dark-
think,
dark-
yeah.
And it, you know, goes on, and I researched that a bit, and it goes on, another plant got sold, and all the, behind that,
Yeah,
and passed it off to the Netherlands currently, it's not so.
yep,
And so, but. And so, something we was, in Hollywood, a lot of it was factual,
mhm,
and, you didn't talk much about it, but. The movie made some things pretty clear to me, led me to research and find some things clear about what PFAS can do to you
mhm.
in a bad way. So,
Yeah.
It's not a personal question, like what happened in your situation with your family?
Yeah. So, so my children, when the contamination was found, my son was 11 months old and my daughter was 3.5 at the time. My son's levels weren't that high and he hasn't had really any health effects. My daughter, she's now 15, but the health effects that she has experienced, she had high cholesterol as a kid, which is associated with PFAS exposure. And that's not something her doctor wanted to treat her for. So that's not normal though, for a kid to have high cholesterol. And then she also had 3 of her childhood vaccines weren't effective, which I know like seems like, oh, okay, but it's like, that's a public health issue, you know, when you're getting vaccines and then your body can't build the appropriate antibody response. And so that was something else that was, and then she also had some like hormone levels in her body that were just really wonky. But that's it so far. You know, she's 15 and we're monitoring her and we check blood work. But yeah, I mean, I feel fortunate that that's all that we've really experienced. There's other families that haven't been so lucky, you know, and there's a lot of adults too. And there's a big population around Pease, veterans, and especially members of the Air National Guard that have come out and said there's really high rates of cancer.
Right.
And Air National Guard is different than the other military, and I'm not a military person, but my understanding is that Air National Guard, you tend to be stationed in one place for a long time. You know, like you live in that community. So they've had years of exposure versus other places that might move around. Although then again, you have a lot of bases contaminated.
Yeah,
So
there's a good reason you do something about it. But in my own education, as little as it was, you know, like there's cancers, a lot of cancers,
Yep.
thyroid problems, things like that.
really, like, I mean, every system of the body, you know, and that's the thing. It's not just like, oh, it's just one thing. I'll bring up that slide.
And then what we don't know.
Exactly what they're continuing. And the other thing that is kind of a challenge with health studies is that, you know, sometimes we see that they only focus on one PFAS, but the reality is you're exposed to a mixture of them. So it's like, we need mixture studies too, and that's another thing that communities are calling for. But yeah, I mean, really, so we're seeing, you know, the things that we know for sure is it can affect liver and thyroid. It can cause high cholesterol, which can lead to heart disease and stroke. I mean, that's, you know, a big deal. It can reduce the effectiveness of vaccines. It can decrease fertility in women. It can have effects on unborn babies, high blood pressure during pregnancy, preeclampsia, and lower birth rates. There have been certain cancers like testicular cancer has definitely, and kidney cancer have been associated with PFAS. PFAS exposure. They're also finding links to pancreatic cancer, breast cancer, and things like that.
Chain of compounded chemicals that existed in that, out of that movie. They did let's shuffle the shells, make a different chemical, remove this and it's not that one anymore.
Yeah.
And then they end up making more and more different PFAS.
Right.
A lot of it is, I think, just what people do, like keep trying to make money.
Right.
But,
Yep, and a lot of what that movie talked about too is, I think the part that bothers me the most is just that DuPont knew for a long time too. They were doing studies on their own workers.
yeah, I know this is about that.
You know,
But
it's like, you know, gosh, if they had a moral compass like decades ago,
yeah, not
maybe,
just DuPont, but all the other
right,
companies,
3M and others too.
Yeah,
But they absolutely put profits
and
over.
there were people that stood up and they got creative. Yeah, it just got.
Yeah.
It's just,
So I think there's a lot to be learned in this, in this situation when it comes to PFAS and chemical regulation.
The other thing is to say, you gotta get rid of it, okay, well, that's a real challenge.
Mhm.
We have embedded,
Mhm.
we've embedded PFAS everywhere.
Right.
Yeah.
Right. Yeah, for sure.
Can you be specific about water filtration? How you filter water?
Yeah. So there's a lot of resources, but really the two that have worked really well is there's granular activated carbon. So that's what they use right now at Pease. And then they also use an ion exchange resin, which is not something you could get at your home. But for larger scale systems, you're seeing carbon and resin work really well. Carbon captures those longer chain PFAS, like the older ones, like the PFOA and the PFOS. And the resin helps get the shorter chains, the more newer PFAS. In terms of what you can use at your home, a lot of people find that reverse osmosis is very effective within your home. So like Merrimack, New Hampshire, I mentioned, there's private wells that have been contaminated there. And so reverse osmosis, I'm not like a water filter expert, but it creates a lot of waste. You know, there's a lot of wasted water through that filtration. So a lot of the people I know in Merrimack will put carbon for their whole house, and that will filter the water coming in. And then they'll also put reverse osmosis on their kitchen sink. So it kind of they have that double method. Now, if you're on city water, that's probably quite extreme because your city has to test for that water. And I know here in the city of Portsmouth, we do have low levels of PFAS in our water. The city is putting some treatment on a well, but if you're concerned about that, you could add reverse osmosis to your kitchen sink, even if you have city water, if you're concerned about it.
Thank you so
Yeah.
much.
Yep. And I know there's a question there, and then I'll.
Just another applied one. Are glass containers free of PFAS? And is there a list anywhere of things that are absolutely free of all PFAS?
That's a challenge. So I mean, PFAS really can, anything you see that's like waterproof or, you know, slippery substances. I haven't heard about PFAS on glass. I think glass is typically considered a safer alternative for cooking and storing food and things like that. In terms of the products that are PFAS free, that can be tricky because right now no one's required to label it. And some manufacturers get kind of deceptive in their labeling. Like if you go to like Home Goods and you look at a pan, it might say it's PFOA free. Well, PFOA is just like, that's Teflon. That's just one of the PFAS, right? But that doesn't mean like it doesn't have PTFE, which is like the replacement of PFOA. But you read that and you're like, oh, PFOA free, I'm making a good choice. But it's just, so no, and I think we need to see more progress on labeling products. So as consumers, we can make informed decisions. Because right now, like you don't know. They're not required to disclose it, and we need to see more. There was a website that was trying to compile, I believe it was called PFAS Central, that was trying to compile some products that had been independently tested. So you may look up PFAS Central, but there's a lot more work to be done.
With the rollback in federal EPA standards, can the state take on and be lobbying and Congress to bring those standards?
So the good thing is that in 2019, New Hampshire passed their own drinking water standards for 4 PFAS, and then the EPA passed it for 6, and now they're rolling back 2. So I know that's a little confusing, but we still have the 4 PFAS standards in New Hampshire, which is great. And actually the 2 EPA standards that they're keeping at the federal level are even more protected than what we have in New Hampshire. So New Hampshire's in pretty good shape. I think it's more we need to strengthen the federal regulations. So New Hampshire's already a little bit ahead, and their standards are still going to stick even with the rollback. So we do have those protections in place. And New Hampshire has been, like I said, really great about going out and testing too. Some states won't even look for this stuff if they don't have to, if they're not mandated. New Hampshire has been like, no, we want to know where it is so we can get out of it. So I think New Hampshire is definitely ready, even with the rollbacks, but they have resources. They were part of a lawsuit where they got, I think, $60 million from a lawsuit of suing chemical manufacturing companies, so they can disperse that money to water systems. So they're in a good shape here in New Hampshire. We're in good shape.
What's your best guess when the CDC will release that medical study?
So they're telling us that it might be later this year, but I also feel like they've told us that for the last couple of years. I am a little worried under this administration, you know, what's going to come out of the CDC, because I just feel like first of all, there's been huge staff cuts. So we have seen just the manpower decrease, and even the people that we worked with at the CDC, some of them aren't even there anymore. And then I also just worry about how they're gonna message the results, because I just think sadly, things have become very like politicized. You know, this should be a public health scientific study, but I just worry what the messaging is that we're gonna get, but hopefully in the next year, we'll have some information.
How safe is bottled water?
So, you know, bottled water doesn't have to, so it's not as safe as like turning on your tap. Tap water, your municipal system has to test for certain contaminants and they have to meet certain regulations. Bottled water is not regulated like tap water. So, you know, some people think drinking bottled water is a safer alternative, but you would really want to know what that bottled water has been sampled for, because it may actually be worse than what you're drinking. And New Hampshire actually ran into that when Merrimack and the Southern New Hampshire issue with the private wells. The state was providing bottled water to people, and then they went out and did independent testing of the bottled water, and they found that some of the testing had higher PFAS in it than what people were drinking. But they found a company in Haverhill that was bottling spring water that had 140 parts per trillion of PFAS in it, and that was like worse than what the people are drinking. So the state went out and did that independent testing, and then they only use bottled water companies. They use water contaminated, but yeah. So bottled water is not safe for all at times. You have to do your research and know, have they tested it? Where does the water? I like, if I'm going to drink water, there's the Sam's water from Walmart. If it's one thing with the label, it's through reverse osmosis, which is. But yeah, you just have to do your research.
Is there a risk from the plastic bottle itself?
I mean, I think from a microplastics perspective, probably. I haven't heard of PFAS in bottled water, like in terms of the bottle, the packaging itself. It's more just from the source of the water where they get it. So I think, you know, initially when this happened, like, again, I was like, oh, well, let's just switch to bottled water, you know, but then it's like you do your research and you're like, well, that's not even as heavily tested. So for me, the choice has been to my city water, which I know is heavily tested, and then that's what I.
Yeah, have there been any wildlife studies?
So yes, the Air Force, as part of their the Superfund law, they have to look at human health impacts and ecological impacts. So they're actually right now conducting they call it a baseline eco risk assessment. And so they've looked at things like shellfish, they've looked at chicken eggs, you know, and so they have found PFAS in some of these things, especially Newington, and they've looked at produce and things like that, plants. So
It's like just wild animals.
that's part of the eco risk assessment. There was a deer study done before COVID. I believe there was Fish and Game did this, not the Air Force, but I'm just recalling this off my top of my head. It was like 15 deer were shot and killed from the wildlife refuge in Newington, and they found that they didn't have PFAS in their blood, from what I recall, but they found high levels of PFAS in the liver of the deer, and they already had a do not eat advisory on deer liver for other contaminants. So, but as far as I know, they haven't really tested like, and we've kind of asked them to test like turkey and other things too, but they're part of their eco risk assessment. They are looking at multiple different species, and we don't have all the data yet, but it's something they're looking at.
In a town like Merrimack, with the Budweiser plant shut down.
I don't believe it did. I don't know. I know it's there. I don't know if they have their own filtration.
They decided to shut down.
Okay. Well, I know
I
St.
wondered if that's related to this.
It could be. It could be. I'm not familiar. I do know that St. Gobain, the actual polluter there, did close up a couple summers ago, and that building's been like completely demolished. And you know, that community is facing serious contamination, and you know, I think it's been a challenge getting St. Gobain to be as cooperative as the community wants. I can't speak for the state and how they've been negotiating with them, but I was saying before this started, you know, on one hand, it's like we're dealing with us at Pease, the Department of Defense, which can feel like trying to move a boulder up a mountain, you know, but on the other hand, they're also like not closing up shop and going anywhere, you know, so like at least they're around and they spend a lot of money, and yes, I wish they could move faster and I wish they could clean up faster, but they're doing something and they can't just kind of close shop and go away. And some communities are dealing with their polluters just vanishing, and now they're left with all this contamination, and then they, you know, it's on the taxpayers or the individual people to have to deal with it, and that feels really wrong. Yeah.
So, we're born and raised in Flint, Michigan. I'm going back to visit in another month, my family. What do I tell them that we're dumping our PFAS?
Yeah, Michigan's had a lot of
I
PFAS
mean,
issues.
but in contrast, New Hampshire used to be a dumping ground for all
Yeah.
the states, many, many years.
Yeah.
But what I just want to generally say is, I've come to recognize more than any, that, more than ever, that what makes the world go round is small pockets of people like you and your group. And takes a lot of time and energy to do that.
It does. You gotta, and sustained energy.
Yeah,
I like
yeah,
to
I mean,
say,
it's cool.
yeah, I'm just as persistent as PFAS. That's what I say. Yeah, and I think it's because for me, you know, this work is like bigger than just me or my family, you know, and or just Pease. Like I realize now, like, wow, there's millions of people like our community, you know, dealing and reeling from this issue. And so, yeah, I'm not gonna solve it overnight, but if I just keep chipping away,
Well,
like,
that's
small
probably the
things
instrumental.
add up, you
That's
know.
probably the instrumental of your influence in turn to involve the whole country instead of just
Mhm.
focusing on the community.
Right.
So, Andrea, I just want to say thank you. I'm so impressed with all your accomplishments. Like I've looked at your website and everything, but to hear it all laid out, all the work you've done over 12 years, you and your group is amazing.
Thank you very
Totally
much.
amazing. So,